Hello.
Hello, Shumani here.
Hi, Shumani. Welcome.
Thank you.
Good afternoon, colleagues. I suggest we start. We have just shy of 50 participants in this afternoon's webinar, so that I think is more than enough to get us started. So, thanks everyone. My name is Jaap de Visser. I work for the Dullah Omar Institute at the University of the Western Cape. And warm welcome to this webinar on transparency in procurement during COVID-19 in local government, which we are hosting in partnership with the International Budget Partnership. Thank you very much for registering your interest and joining us this afternoon. Before I say a few more things about the content and program, maybe it's good to start with just a few house rules. I think many of us are becoming very accustomed to all the Zoom meeting house rules, but just to state them so that we all on the same page. It's important to adhere to them because we are a big group in this meeting. So please mute yourself, keep yourself on mute unless you are taking the floor to make a contribution. Also, I think to save bandwidth, keep your cameras off unless you are taking the floor. You're welcome to use your camera when you're taking the floor, but otherwise it may be best to keep the camera off because it saves everyone who's on this call a lot of bandwidth. Use the raise hand function if you want to ask a question. You can find that on the right hand side of the Zoom interface. Also for those, I don't see many of it, but say if your name reflects as admin or XXX, kindly rename your thumbnail so that we can see who's in the room. It's always nice to see your name as opposed to a code. We are recording this session, so I hope that's okay with you. If it isn't, then maybe this is a good time to leave or watch what you're saying, I guess. But we want to record the session so that we can benefit from it further on. There's a number of colleagues in the meeting from IBP and the Dullah Omar Institute who are also helping me in the background to manage the meeting. Ms. Valma Hendricks, Ms. Mandy Cupido, and Dr. Tanash Chigwata. They will also do some firefighting in the background if need be to deal with technical glitches or get people connected. So don't panic when they approach you to switch off your camera or when they help me to manage this meeting. But welcome, 59 participants now. I think that's wonderful. That's a great group. We had about 200 people that indicated interest in this meeting. So clearly we're onto something with this topic. I want to start off introducing the topic with a quote from our Minister of Finance, Minister Tito Mboweni, who said a few days ago, he said, "As Minister of Finance, I am very concerned that no sooner had we made budget allocations towards the COVID-19 interventions than tsotsis started to plan to steal." And for those of you who don't know, tsotsi is basically slang for criminal. That is a very serious problem that we have to deal with and deal with decisively to make sure that the funds allocated reach their intended purpose. And of course, as across the globe, there's been rapid procurement in South Africa across all three spheres of government, field hospitals, medical equipment, PPE, lots of rapid layout of infrastructure in water and sanitation. And we're already hearing reports of problems in procurement. I think we all, as South Africa, bemused with the motorcycle ambulances that were purchased in the Eastern Cape, maybe not directly linked to COVID-19, but an example of probably of procurement gone wrong. For local government, it has meant procurement of masks, sanitizer, water tanks, and very importantly, improving and servicing sanitary facilities in informal settlements that are so vulnerable for the spread of the pandemic. So clearly, the importance points to the importance of procurement, and particularly transparency in procurement. Municipalities must make sure that procurement is done according to the rules. But clearly, if we look at the reports of the Auditor General, those internal rules often do not work, and often stuff goes wrong there. So therefore, it highlights again the importance of communities that are well placed to point out to government and to the media and elsewhere that services are not reaching them, and that the promises that were made and procurement contracts that are in place are not always delivering the results that are promised. So communities are very important partners in ensuring that procurement actually benefits communities. So we decided, IBP and ourselves, to discuss this in a webinar, and we brought together a wonderful panel of experts to guide us through that discussion. Before I introduce those, I want to quickly turn to Albert van Zyl, our partner in this webinar, so that he can also address you briefly. Albert, are you with us? Can you say something to us quickly? There we go. Thanks.
Great. Thank you, Jaap. And despite Cape Town having a little bit of sun today, it's still pretty freezing, hence all the clothes that you see in front of you. Fantastic. Yeah, we're really proud and excited for the partnership that we have with the Dullah Omar Institute. This is the second of these webinars that we've done, and your enthusiastic participation has been wonderful. I wanted to just point out that you'll see in the list of speakers that we have for this afternoon, we have got a representative from an organization like Planact that works very closely with informal settlement communities. In their case, largely in Gauteng. Then we have some of the intermediaries that work with organizations like Planact, so like IBP and the Open Contract Partnership. Then you'll see that Dr. Krish Kumar, the CFO of eThekwini, is on. So we've got a Metro local government itself in here, and then the Office of the Chief Procurement Officer, Ms Duiker, with us, that plays a regulatory function in all of this. So you'll see that this, in a sense, represents the whole supply chain ecosystem, as it were, and everybody that plays a role in it. And the reason why we assembled this group is that that it's pretty hard for any one of those players to ensure that procurement happens seamlessly and appropriately on their own. We do need everybody in the system to help, and perhaps as a goal for us for this afternoon, but also as a bit of a theme, is to think about how we can help each other. Because you've all heard some of the estimates that have been made. That I think the estimate is that around 40% of government spending now is procured. So it's a significant area of expenditure, and if we can figure out how we can help, how we can ensure that everybody that's in a position to help, so communities, intermediary organizations, local governments themselves. I see that the Deputy Auditor General, Tsakani Maluleke, is on the call, so the Auditor General, and other regulatory bodies like the National Treasury in this case, how we can help each other do this job. Perhaps that's a worthwhile a goal to aim for. Thank you, and looking forward to the discussion. Back to you, Jaap.
Thank you so much, Albert. Thanks for those welcoming words, putting this meeting into context. So thanks again to everyone for making time available. Really appreciate, because I see some names in this meeting of people that really I know have very, very busy lives and busy professions. So we really appreciate you being with us. So quickly, the lineup for this afternoon: Ms Shumani Luruli and Carlene Van der Westh will kick off the discussion. Ms Luruli represents Planact and Carlene represents IBP. So they will kick off the discussion with an input. Then we go over to Dr. Krish Kumar, the Chief Financial Officer of eThekwini Metropolitan Municipality. Great that you're with us, Krish. Always, yeah, fantastic to have your views. You're must be one of the longest serving CFOs in local government, and always willing to make contributions to debates such as this one. So much appreciated. Ms Basani Duiker, as mentioned by Albert, representing the National Treasury. She's the Chief Director, Supply Chain Management, Governance, Monitoring, and Compliance in the National Treasury in the Office of the Chief Procurement Officer. And then we finish off with Ms Carey Kluttz from Open Contracting Partnership, which is an international organization that works worldwide to transform government contracting. So she will give us an international perspective all the way from Washington. Welcome to South Africa, Carey, even if it is virtually. Each speaker has about 10 minutes to make their input. And after that, we will then open the floor for some questions and answers and further engagement with yourselves. Also to quickly point out, there's a background note that was prepared for this meeting. I'll put the link quickly in the group chat so you can peruse it while you listen to some of the inputs that was put together by IBP and the Dullah Omar Institute to put out some of the key questions guiding the discussion this afternoon. So without further ado, can I hand over to Shumani and Carlene, who are going to do a joint presentation to get us going. Over to you, ladies.
Good afternoon to all colleagues. Maybe I should just indicate that all protocol observed. As Jap has said, my name is Shumani from Planact. And I think in a way, I wouldn't have much to say, but I was interested and intrigued by your opening statement, a note from our minister about what they're anticipating or what they think is happening. So maybe before I can go any further, my question will be to the minister. What is it that they are doing to make sure that these sources that he's talking about do not win this time? Because apparently we can be transparent about them. If we know that there are sources, let us be transparent about them. And let's also flush them out. Who are they? Where are they? And what are they doing? With that said, I think what I was meant to just quickly share with you, it's about why is transparency so important for us in the communities at grassroots level. I know Carlene will talk more about a municipal level and all that, but for us in the community and the work that we are doing and the people that we are partnering with, I think we had always said it is very important for local government or municipalities or the metros to be transparent about the services that they are bringing to us as the community. One of the big challenge is, you have seen and you know that a lot of the services that we receive in communities and especially in informal settlements, it's outsourced. Most of it is temporal. Most of it is something that we are hoping will change with time. And there will be permanent solutions to these services that we want. And in a way, the transparency in terms of the way they procure and what is supposed to come is very important, because if they're saying we will bring water to your community and you will only get it through water tanks because we can't build infrastructure in your informal settlement, it's well and good. But the truth is there is money that is being spent in our name. So it's very important for us to know who is going to bring this water, at which specification or standard are we going to receive this water. And it becomes very important that we get to know that as the community. There was something very interesting when we interacted with our Civic report in one of the municipalities. We just got a response to say, look, water tanks come to your community every day. But that's not enough, because when we monitor on the ground, we go 2 days, 3 days without water. So I'm just making a point here to say procurement information, we are not saying it should be transparent just for the sake of it. Maybe one can also ask, with this local government, do we have willing officials who wants to make information transparent for communities? Are they able? Is it something doable, or is it just the matter of compliance? Okay, well and good, we sent out a tender document and people have tendered. Yes, there is a schedule, but what type of information are we sending out there to communities so that they can know and be able to say, for sure, when we monitor this service, we can see value for money. When we monitor this service, we understand the service standard, that it's respecting our community and our rights to this basic service. And I think for me, those are the just few issues that I will raise to say, as grassroots, as communities, we want to have tender specifications that talks to our needs and that talks to satisfying our need for service delivery, be it sanitation, be it water, be it, the grading of our street, the collection of refuse. It's very important. And at the moment, what is very important and we want to see happening, it's information about this. At this moment, there is COVID-19. We are told to wash our hands every day, every time we touch any surface. We are told to clean every surfaces. We are told to be cautious. But again, we still have water tanks that are coming in and they are put at the corner of that street and another one. We are still getting toilets that are not being drained. And we can't even challenge because we don't know, in terms of the plan and those who have procured this, how many times are these trucks supposed to come to our communities? How many times in a day? How often should they sanitize these places? We are not even sure, because as we see them coming in, we don't see sanitizers, we don't see any of the things that we have heard that our government will be providing. I think for me, I will leave the platform for Carlene to talk more about, the importance of transparency in this time, and especially with procurement. Thank you.
Thank you, Shumani. That was very, very useful. Thanks so much. Over to Carlene.
Thank you, Yof, and thank you, Shumani. Thank you so much for that. So the IBP South Africa have been working for a number of years with Planact, and specifically with Shumani and some of her colleagues, and also with other civil society organizations and with the communities that these organizations work with, to monitor the implementation of contracted services, so these outsourced services provided to informal settlements. And one of the specific areas that we often provide support is in accessing procurement information. So while Shumani has explained exactly how critical it is for residents living in informal settlements to have access to this information, I want to just say a few words about how difficult it actually is for informal settlement residents and also the civil society organizations that support them, and even organizations such as the IBP, to actually access the applicable and relevant procurement information. So in terms of what is really important for residents, like Shumani said, residents want to know exactly what should be delivered in their informal settlements, how often a service should be delivered, and also who's responsible for that. So number one, it's important to have access to bid specifications as part of the bid documents. And we found through our work with informal settlements and organizations such as Planact that many municipalities still don't actually publish the full set of bid specifications with their tender notices on their websites, or they don't submit it to the national e-tender portal, which they are supposed to do. And we also still see that in some cases, bid documents, which includes the specifications, have to be purchased from the relevant municipality. And often we look at hundreds of rands. So that is something which makes it impossible for residents in informal settlements to access these documents. And then another big challenge is that once a contract has been awarded, the bid specifications are no longer publicly available. Municipalities remove the information shortly after the bid closing date. On the e-tender portal, it almost looks like an automatic process that on the day the bid closes, that information is no longer publicly available. So if you missed your opportunity while the tender is open to download or to purchase those documents after the closing date, and certainly after the award of the contract, residents no longer have the means to access that information. And we know that the specifications very much form the foundation of the contract in terms of what should be delivered. In some cases, the specifications also make mention of additional agreements or service delivery schedules that will be drawn up after the award of the contract. And again, in the case of services delivered to informal settlements, these agreements and service delivery schedules often provide more information on timing of services, which settlements will receive services on which days. And these additional agreements and schedules are actually never made publicly available. And then finally, we've also noticed that not all municipalities actually publish the information on the tender awards, so who actually won the contracts within 7 working days after the award. And they are also similarly lax when it comes to publishing information about extensions and deviations from existing contracts. So these are the challenges that informal settlement residents and civil society organizations have experienced even before the onset of the pandemic. And we've seen since the start of the pandemic, specifically in our work that we've been doing with CSOs and communities, that it's actually become an even greater challenge, that specifically during the levels 5 and 4 lockdown periods, municipalities were really slow to make any tender information publicly available, and specifically related to emergency procurement. And we've also seen huge gaps on the e-tender portal where municipalities have simply not submitted that information to the portal. And just to follow on from the example that Shumani mentioned about the water tankers. So through the project that we work with Planact and other civil society organizations, where we ask residents to provide information on services that's being delivered during the pandemic, including the delivery of water, it was highlighted to us that water tankers in a specific metro are not being filled up regularly. And it was impossible, and we still haven't managed it to this day, to actually find out the exact name and number of that tender contract. There was some vague reference to a tender for basic water, which we think might be relevant in this case, but we're not sure. There was just this vague mention to that tender on the website of the Metro, but we've not been able to find out if this is actually the contract that's applicable in this case. We've not been able to find out what the specifications say for that contract. So the specific community, the residents, don't actually know how often the water should be delivered. They don't know, are there clear specifications that the tankers should be filled completely, or if a contractor comes more often, they don't need to fill it completely. We have no information to actually hold that specific Metro accountable against. And so you can see, especially in when we experience a pandemic as we do currently, access to information is critical. Just to end off on a slightly more positive note, we've actually seen since the beginning of June that there has been some improvement in how municipalities have been making procurement information available either on their websites or on the eTender portal. Thank you, Job.
Thanks so much, Carlene. Very critical input by both Shumani and Carlene. Because it makes it very clear that when we talk about transparency in procurement, one has to get practical about these things and look into the detail of the procurement ecosystem that Albert spoke about. And Shumani pointed out very clearly that practical information about how many times is these tankers supposed to come, and where do we find out about that. And I think Carlene put some very useful information across on how that translates into what the system offers and what it should offer to communities to assist the municipality to hold service providers accountable. Clarity around the bid specifications, service delivery schedules, keeping the tenders available after the award has been done and don't make them disappear the moment the award has been done, providing clarity on deviations and extensions. And then the bad news that during COVID-19, these things slow down even further, even when they weren't perfect before that. It's important to also listen to a municipal perspective, and I'm very keen to hear Dr. Krish Kumar on this, because of course there are also limitations to what municipalities can and are allowed to make transparent, and what progress has been made in that respect. So over to you, Dr. Kumar, and we look forward to hearing from you.
Welcome, Job, Albert, and the rest of the participants on this webinar. I think at the outset, let me indicate I'm not going to be defending local government. I'm merely going to be stating to you the context under which we operated during COVID. I think much of what has already been said in terms of the current state of local government insofar as procurement is concerned, I can identify with, and I certainly appreciate those comments. But the context of this is strictly in terms of the brief that I was given with regard to COVID-related issues. I think the first thing for me is that right up front, our mayor indicated that he wanted us to procure, but procure effectively, and he asked for every price to be benchmarked. That particular oversight report will be submitted to our executive committee, so nobody will get away from benchmarking of prices and value for money. The second issue I think that I heard coming through is compliance, and I fully agree that insofar as advertising, awarding, and oversight of contracts, there can be no excuses. I think the supply chain regulations are very clear regarding these issues, and I think I would say to colleagues that please, let's not tar everyone with the same brush. I think procurement generally, when you look at the AG's report, I would agree with 38 billion Rand worth of irregular expenditure. It really puts local government in a very, very bad light, and I can certainly appreciate some of the sentiments that are coming through. However, not all of that irregular expenditure is fraudulent, wasteful, or fruitless, and I think now that the AG has got the Public Amendment Audit Act in his power to actually ensure recoverability, and the issue of MI, which is material issues in the audit finding, where you can go for recoverability will certainly, I hope, put pay to those people that have been benefiting unfairly from a process and all the fraud and corruption that is linked with these type of activities. Let's hope that this is curbed through the AG's new powers. And that's not to say that municipalities should be acting in the first instance. Therefore, I believe transparency and accountability should be of the highest order. If I look at specifically the circumstances that prevailed, and I take you back to when we actually went into the actual lockdown mode, and the fact that we weren't given sufficient lead time. I think everybody would agree to ensure that the SCM process could have been followed in terms of fairness, equity, transparency, competitiveness, and certainly to some extent cost-effective procurement processes. We used Section 36 extensively, which is a deviation from competitive tendering, where we had to procure as a matter of emergency in many instances, and particularly where we had frontline staff. We couldn't stop the refuse service, we couldn't stop the health service, the city police service, or for that matter, the refuse removal workers at short notice. Whilst people were working, and within a week or so, we had to procure the necessary PPE to ensure business continuity and to actually further reduce the health impacts, etc. And again, I reiterate, the benchmarking had to be in place and the ensuring that as far as is practicable, that we are able to ensure value for money in every instance. I must commend National Treasury in terms of the fact that they gave good guidance and support in terms of the exemptions, and the circulars number 100 to 102 really well informed the circumstances under which we could actually procure. And I think what was also very effective on National Treasury's part was the fact that they brought in transversal contracts, and I think that really made us, put us in a position where we could acquire from transversal contracts that are put out by the state. And I think together with that, they published benchmark rates for several items that were commonly being procured in terms of PPE, and we were required to ensure that our purchases were within these benchmark rates. So I must really commend that leadership role by National Treasury. However, what crept in at that time as well was the local BBBEE components and the RET, Rapid Economic Transformation issues. Those imperatives had to be promoted as well, because as part of our procurement strategy, we ensure that we take into account these particular groupings as part of ensuring an effective procurement spend, and that we actually, those disadvantaged would actually benefit from procurement. That's not to say that they benefit in terms of pricing, but surely in terms of ensuring that they have access to contracts. So that was also put in place. So these extenuating circumstances was further exacerbated by lots of suppliers being closed and also not being geared to provide the necessary, whether it was masks, face shield, sanitizers, screens. This was a huge challenge with limited staff at work as well. At lockdown 5, if you remember, very few people could work. We were busy sorting out permits, and yet we had at least 25 to 30% of the metro at work, almost 10,000 employees. So I think those issues need to be held in the background. And again, I do not submit to anything with regard to accountability and transparency, notwithstanding these issues. The short lead time as well, and not knowing the full requirements. So are we purchasing weekly, monthly? How long are we purchasing for? And what are we purchasing? I think as we moved into the very early weeks, occupational health and safety standards as well changed with regard to FFP2 masks. You'll remember the controversy around that, and the N95 mask for frontline nurses, where everybody wanted that, yet it was going to be reserved for frontline staff who really needed them, and that was not the staff nurses. So I think those issues must be appreciated, and then the non-medical staff and how we manage what their expectations were in terms of their safety, etc. Notwithstanding all of that, I still do believe that under the circumstances, and each city must be able to justify their own, because I think, again, it cannot be a blanket approach for all. So we certainly will be able to justify our value for money, our benchmarking, and why we actually were able to procure what we procured and I've made that very clear to the procurement team that they would have to account for every item that we purchase, and that nobody would actually be allowed to procure without following a process and being able to justify and determine benchmarking, etc. The specifications that were mentioned earlier were a key challenge, and the technical standards also in the early days was a real problem in terms of how we manage. And again, the masks come to mind, and several other areas of procurement, including sanitizers, which were the appropriate sanitizers to be used. And I think also the cleaning standards that were required in the workplace, because remember, we were told that you needed to actually ensure that you need to have the offices clean and ready for people to come back. And you can see the drama that went on with the openings of schools. The biggest challenge, however, for me is the financial management of municipalities in terms of sustaining these additional costs in the long run, and actually being able to keep these costs without compromising the safety of people, and looking at, therefore, balancing our own socioeconomic objectives as well as the priorities. And these are often competing priorities because you want to actually ensure that you do not want to put anyone at risk, and then you want to be innovative and creative. And I'm going to give you an example. So the example was that a 70% alcohol-based sanitizer must be used. The cost of that is about, you can pick your price, anywhere from, we paid 70 Rand, I think, for a 500 ml, and it was about 130 Rand for a liter in the early days. If you buy the 5 liter, it's much cheaper. If you buy 20 liters, it's much cheaper. And I told our people, let's start decanting as a practical example. And then I went to University of UKZN with our own water division, and we said, what is an alternative if we're giving particular, and I refer to the informal settlements in particular, if you're giving support to abolition blocks, etc., and you need this, we cannot sustain these prices, and that's where the tension comes in. Without compromising safety, what would be an alternative? And they came up with the Dettol and water solution at a fraction of the price. So that's one example. We also learned the hard way that initially for the homeless, at very short notice again, the president announced that we should be actually providing accommodation for the homeless and providing for the support for them, as they were a very, very vulnerable group. And again, we were hiring marquees in the initial period, primarily because it was really problematic in terms of how long this would last. We thought, in all fairness, it would be a month. The first month, we paid quite an exorbitant rate in hindsight of about, and it was done fairly, where we actually went out and put out I think it was about a 3 or 5 day tender on our website in terms of e-procurement, and we came out with about 12,500 per day. Within 2 or 3 weeks, we reduced that to about 8,000 Rand. And in discussing with our political principals, we felt it's far more cost effective to buy. And we bought marquees anywhere between 60 to 80,000 Rand. But it happened within 4 to 6 weeks of us hiring. So those are some of the practical issues where hindsight is an exact science. And I can give you lots of examples around that. I think the bottom line here for me is that we need to actually ensure that at all times appreciate the context, ensure transparency, ensure benchmarking of prices, ensure compliance is kept to the highest order, and hold people accountable if they're not delivering in terms of expectations. So I would think I'll hold it there. And I'm not certainly going to defend any of the issues, and certainly would like to ensure that we all are held to account for whatever actions we've taken during this period, and particularly where there's any fraud, corruption, or maladministration, we must account for same. Thank you.
Thank you so much, Dr. Kumar. I think that was a very useful input, given context, and also bringing us to the hard reality of how challenging it is to manage procurement during a disaster and at such short notice, and with so many difficulties coming at you. The one sort of question that I wanted to maybe just put to you, and if you want to defer it to the Q&A, that's absolutely fine. But just to invite you to maybe say 1 or 2 things about, so what if after the award has been made, what is sort of the municipality's role in bringing communities into the monitoring of the delivery? Because that seems to be an issue that Shumani and Carlene raised, that yes, the award is made, and you know, transparency is there in terms of the decision is published, process has been followed, but then the delivery must happen. And for communities to be able to monitor that, they need to know certain things, like what were the specs, what was the service delivery schedule, has there been any deviation? And it seems that often that information is missing. Anything you want to say about that now, but feel free to defer it to after.
Yep, I must say that we are not strong on this. I think we rely a lot on our the fact that we procure and we act in the best interest. Sometimes it's just there's not sufficient time to consult effectively. Now, if there are appropriate structures through either ward committees or otherwise that we are able to engage with, we'd be able to appropriately deal with those matters through the respective ward councillors, etc. So I think if you had to ask me if we're dealing directly with communities with regard to these issues, I'm going to say to you, no, we're not. But where there are established structures, we will endeavour to actually, through the ward councillors and through the governance structures, ensure that there is accountability. Certainly with regard to our own political oversight, all of the procurement issues are channeled through the respective committees in terms of indicating what contracts we awarded and in terms of the prices that we awarded, etc. But to communities, no, we don't specifically go out to communities, and it's something perhaps we need to work through.
Great, no, fair enough. Thank you so much for giving us that extra insight. Thanks so much for that input. A quick note from the team managing the meeting is, if you can please make sure that your name reflects. If your name is XXX info something, then we're not quite sure who is in the meeting, and we all know that some of these Zoom meetings, there's a lot of mischief happening as well. So please make sure that we can see who you are by having the name reflected on your thumbnail. Thanks again, Dr. Kumar. Let's go over to Ms. Basani Duiker from the National Treasury, looking at the issue from a regulatory point of view. Over to you, Ms. Duiker. We look forward to hearing from you.
Thank you so much, and I think it's such a privilege to be amongst people who are, you know, show interest and are concerned about how we are dealing with issues in the country. You know, it's encouraging to hear that we are all interested and we all want to play a role in resolving the country's issues and making sure that everyone is catered for and is taken care of in our country. So from the National Treasury's perspective, like you rightfully said at the beginning, that we mostly participate or come from a regulatory point of view as the custodian, as the custodians of sound and effective financial management prescripts, which include supply chain management. You know, we are very concerned as well and interested in paying the right amount of money for the right things. I mean, simply put, without throwing jargons into what we're talking about. And what is important in that is that when you deal with issues of emergency procurement, we need to also understand that we're dealing with situations which at the time we define as sorry, Chairperson, I just we're talking about situations which at the time, at circumstances that require immediate action, that require immediate intervention, which could not have been foreseen or planned for, and therefore, you know, it's reaction at that point in time. And when we come to particularly regulations, the MFMA regulation 36 clearly provides a procurement in those circumstances, and allow for accounting officers to deviate or dispense of the normal procurement processes, which is your normal tender processes, and use whatever mechanism that are in place at that point in time to allow them to respond to the situation at that point in time. Chair, I'm not very familiar with Zoom. I actually just want to, if I can possibly share my presentation in front of me, but it says the host disabled the participant screen sharing, so I cannot really share. So I will talk through it.
No, but we can make that happen. If you give us a second, we can give you permission to share. I'm just looking at my team. Can we make sure that Ms Duiker has permission to share her screen? Can you try again, Ms Duiker?
Okay. Are you able to see it, Chair?
Not yet, but there we go. Yeah, something is happening. So yeah, there we go.
Got it.
Yeah.
So I was still saying that legislation that deals with issues of emergency procurement has always been present through the MFMA Regulation 36. That allows the accounting officers to dispense of open competitive processes to procure for goods and services. And if I can just go into a little bit of detail on that, it provides that accounting officers can dispense in cases of emergency, or if such goods and services are produced and available from a single or sole provider. And as acquisition for special works of art or historical objects and any other exceptional cases where it is impractical or impossible to follow official procurement processes, then you can dispense of those open competitive processes. Then it further requires that the accounting officer must record the reasons for these deviations and then report to the next meeting of council and the board of directors if it is a municipal entity, and also include a note to their annual financial statements. All right. So and that is generally what has always been there in the prescripts. But with COVID-19, and the national state of disaster was then declared, further guidance was provided by the National Treasury, as Dr. Krish had said in his brief, and it was a quick response, and because the circumstances were changing very fast because of the unfamiliar territory that we had found ourselves in globally and as a country, we had to respond that quickly. And we issued first the instruction note 100, the National Treasury Circular 100 for local government, which availed the transversal contracts and a list of service of other suppliers in the country that could provide particular goods and services that were related or that would allow government institutions or municipalities to respond to the national state of disaster. Again, this was in a bid to ensure that we respond to our concern of making sure that we pay the right amount of money for the right things. And as time went on, we then realized that the competition for especially PPE items was global. So it was countries competing with other countries for the supply of the PPE and the highly increasing demand for the PPEs. And very quickly, we found ourselves in a position where we had to centralize so that the country's demand is understood at a single point, and so that the competition or rather, yes, the fight for supply is then channeled correctly. Again, considering the issues of price increases and so forth, it was quite critical that we become coordinated as a government. And at that point in time, Chair, I think I would like to bring this observation that I had, is that when all these prescripts were happening and the national state of disaster had been declared and there was the level 5 lockdown, many institutions, institutions within both public and private sector were in the face of effecting their business continuity plans. And I don't think a lot of organizations, both public and private sector, were actually very ready to effect business continuity plans of this magnitude. And as a result, when as a government we were trying to make sure that service delivery continues and curb the spread of COVID-19, businesses as well were also struggling to continue with business because they were effectively not also ready for business continuity when everyone has been disrupted. And then at that point in time, we then issued instruction note 102 when everybody now seemed to have grasped the situation and seemed to have been coming back to some sort of normality in terms of operations, and supply was starting to pick up in the market, where we released the bulk procurement strategy and went back to the normal emergency procurement procedures, where the different institutions would need to be accountable to whatever emergency procurement methods they choose to conduct. Moving from that, in the local government space, through Regulation 36, the reporting requirement has always been to council as well as through the annual financial statements. But the introduction of the circulars that I provided in the previous slide introduced a new reporting requirement for local government, where all COVID-19 deviations above 1 million are supposed to be reported to the relevant Treasury within a specified period of time. At the beginning, we started with 30 days and later on shortened the period and moved to 10 days. This for the local government was actually a new requirement. It has not been there, similarly, because it was never required through Regulation 36. What we have seen that then has become an issue is that it may not necessarily be an issue, Chair, but more of a downside to what we have as prescripts currently, especially the circulars that we issued with the declaration of the national state of disaster through the COVID-19. Is circulars are not mandatory. And they are not, they do not hold the same legal position as an instruction note, and therefore are not mandatory by nature unless they are adopted by council. Therefore, the municipalities are not really mandated to comply with them, which means that even the new reporting requirements that we have put through the circulars are not so mandatory unless council adopts the circular specifically. We've also seen that because the Regulation 36 does not really provide, and actually it allows for any method of procurement to use for emergency procurement, is that different municipalities and different organizations use different methods to procure. They may completely discard a competitive process, and a competitive process, I mean something as simple as a request for quotation or inviting a number of suppliers or service providers to give price quotations before they award. They can just award through what we call a negotiated method.
Other institutions may go for something as simple as looking at their current contracts and expanding them by whatever the need is at that point in time. And these downfalls, put us as government in a position where the monitoring is reactive rather than proactive. It also puts us in a position where it is upon the municipalities to decide whether to report or not, and we think that it is also then open for abuse. It will be interesting to see as time unfolds what is going to happen, because as I move to the next slide, you will see the issues. I will talk to the issues that directly related to deviations, and particularly more so for emergency procurement, where everything is done very quickly and there isn't time for monitoring and detecting issues, and make sure that anything that has not been done in a manner that is supposed to be, or has been intentionally done for fraudulent or criminal activities doesn't go undetected, right? One of the issues of deviations is that it is one of the biggest drivers of irregular expenditure in the country. Why? Because we define emergency differently, even though from our perspective, we think that emergency is clearly defined as, like I said at the beginning, circumstances or a case where there is immediate threat to life or state resources. We have seen that organizations sometimes take procrastination and poor planning that has led to an immediate need to deliver either services or to deliver on performance target as an emergency. And we do not necessarily see it as an emergency, and AG has previously not seen it as an emergency, and it would lead to irregular expenditure. And we believe that any deviation that could have been avoided through the proper planning, also, in our view, it is self-created or self-induced emergency. And again, we then say that there should have been proper planning in the very first place. And if there was that proper planning, the emergency would not have risen, and therefore the deviation would not have been needed at that time. What I said earlier on with business continuity is that it's interesting. It will be interesting to see how the impact of inadequate and probably what's the word? Insufficient business continuity planning will have, on the implementation of business continuity during the COVID-19. So I'm in the situation where departments and municipalities had to make sure that they continue working and deliver services while responding to the national state of disaster at the same time. Are we going to consider the fact that there was inadequate business continuity planning to respond to a disaster, a poor planning? Is it going to be regarded, therefore, as a self-induced emergency? And I'm talking about issues where institutions have used buying of laptops, increasing or expanding contracts for 3G cards or things like that, to ensure that people work from home as an emergency? Should those things have been in place prior the emergency? Should the institution have been ready for this a kind of business continuity before the national state of disaster? I don't have an answer for that. I'm just thinking it will be interesting to see how that is going to pan out. And one more other issue, and I think you've alluded to.
Sorry, I just don't want to rush you, but could you move towards the end of the presentation? Thank you.
Thank you. And one matter you raised earlier, Chair, around the non-awarding of bids, or when bids have been awarded and there's no delivery, and there's procrastination within the institutions, and how we will look at that is also the other matter. How do we think that this can be resolved or can be improved? We believe that the draft procurement bill that has been out for comment particularly strengthens the National Treasury as the custodians of supply chain prescripts to look into the different prescripts and their standing in terms of whether they are mandatory or not, and can be able to enhance their applicability. Also, we believe that there should be some sort of a guidance that provides methods for emergency procurement. We, of course, have to strengthen the reporting processes and probably put in a system to automate the reporting of emergency procurement. Dr. Krish alluded to consequence management for non-compliance, or what's this, criminal practices and fraudulent practices in the environment. And of course, AG being our Auditor General and available to later on audit, although I believe my challenge with focusing on audit and assurance as the last line of defense is that at that point in time, a lot has been done. Public funds have been stolen, and at that point in time, we're just chasing the people who could have done any wrongdoing at that point in time. We could do better if we could detect these things well in advance, or even prevent them from happening, Chair. So thank you very much. I will leave it at that.
Oh, thank you so much. This was really, really useful to get input from the National Treasury on a regulatory point of view, how the system ought to operate. And I think this was very, very useful. And there's already interesting conversations happening in the chat, and I encourage you to take part in those discussions. And Ms. Duiker, if you don't mind, I'm going to put to you a similar question, and again, feel free to defer it to the Q&A, but just your view on the issue of, because what I'm sort of getting from your presentation, similar from Dr. Kumar's presentation, is a lot of emphasis and energy and resources arguably goes into institutional mechanisms for oversight, you know, the reporting and the oversight mechanisms where the institution itself or government as a whole seeks to extract accountability from the municipality. My question is the same amount of attention being paid to ensuring transparency of what has actually been purchased, so that communities can be partners of the municipality in holding the service provider accountable? Interesting discussion in the chat box. Some saying, well, that's the role of the ward councillor. We need to leave that to the ward councillor. He or she must know what's happening in the ward. The response is, well, sometimes the ward councillor doesn't even know the details of the contract or the service delivery that is expected or that has been purchased. Do you have any views on how the system should respond to that need for transparency? And again, if I'm putting you on the spot too much, we can defer it to the Q&A.
No, it's okay. I think I'll go ahead and share my view on that matter. So I believe that as a country or as a government, we've got a very strong a governance structure and governance processes in place. We have, I believe, the structurally the right committees and the right channels for for approvals, let's start there, and for reporting, for accountability to then be sought after. And within those governance structures, Chairperson, you are quite correct that councillors and ward councillors are sitting in those governance structures. They can get access to that information through the municipality and provide that information to the people. That's the first. But secondly, I think we must also remember the fact that all these contracts are put in place to ensure service delivery. So the delivery of these contracts are within the communities, are within the municipalities themselves. And therefore, the delivery of specific contracts and projects should be visible to the people that those contracts are intended for. And because these projects are published, for example, through the e-tender portals and so forth, the community has that platform to gather information on what were the projects or the tenders intended for in the very first place, so that they can do a balance and check at the end on what was the project intended for and what is being delivered on the ground. But further to that, I think procurement plans are also published, and procurement plans sometimes goes, I think, actually not sometimes, they go as far as providing even the value of the projects that are going to be advertised in future. And if you follow the procurement plans of government, in cases where deviations come into play, first thing is you as a member of the community would be to check whether that deviation was planned for in the procurement plan. If it was not planned for, where does it come from? Why has it come up all of a sudden? And so that you can then be able to hold again the people who are charged with the responsibility to manage and safeguard the state's resources accountable. But further to that, we have got the public, the PAJA, Public Administrations and Justice Act, and the PAIA that allows anybody in South Africa to have access to public information or state information. So I think I'll leave it at that. Of course, I think we can strengthen it by making it easily accessible, probably, and talk about it more often rather than waiting for people to ask the questions. We should, as government, I think, go out there and talk to the people. Thank you, Chair.
Thank you so much, Ms. Duiker. That was really, really useful. And thanks for making time available and engaging so candidly on the issue of contracting and procurement. Much appreciated. Let's move over to Ms. Carey Kluttz, all the way from Washington. Having listened to all of this, are we on the right track? How do we compare internationally? And what are the challenges and opportunities that are out there in international practice? Let's listen to you.
Thank you. And happy also to share a presentation as well if, let's
Go
see.
ahead. Yeah, we are seeing it.
Working? Okay.
Yeah.
I'll find the, whoop. All right, we're good?
Yes, we can see it. Yeah, go for it.
Cool. So I'm Carey Kluttz. I'm head of country programs at the Open Contracting Partnership, and really excited to be in South Africa this morning. Sort of jealous of all of the jackets that everyone's wearing here. It's 35 degrees today and humid, so ready for fall. But thanks so much for having me, and it's been really interesting listening to both the conversation around the presentation so far, and then also sort of reading through the chat. So I'm going to sort of scale back, I guess, scale up, zoom out, and talk about some of the work that we do and some examples from around the world that might be interesting for you all. For those who don't know us, the Open Contracting Partnership was spun out of the World Bank just over 5 years ago. And we work to transform public procurement so that it's open by design, fair, and efficient. And we work with government, businesses, and civil society all along the procurement process and all around the world at city, national, and regional level. And we work with partners to publish and use open, accessible, and timely information, and also engage different stakeholders to identify and fix issues. And a lot of that has come up already in the talking points, so I'll try and speak to that. I think the big thing is that last bullet point. We're not after just a bit more transparency, but we want to fundamentally better, smarter public contracting for citizens. And that really gets to the service delivery issue that's come up both in Ms. Duiker's remarks and also in the chat as well. So as I mentioned, we work across the entire contracting process. And this sort of explains that in a nutshell. It's not just the contract itself, but we look at the entire process from planning through tender and award, and then through implementation, which includes the actual delivery of the actual services that have been contracted. And so this shows our best practice open data schema. Is called the Open Contracting Data Standard, that explains all of the information that in an ideal world should be published across that entire process. And it's interesting to me that this has already come up. I think especially Shumani and Carlene mentioned some of the specific pieces of information that would be really useful. And so we've got lots of guidance on how to work to publish that information that might be especially helpful. Ideally, this would be as standardized, machine readable open data. And one of the strengths of the OCDS is that as it's a standard, that allows for reusable tools to be built on top of it. So if someone in Colombia, which you'll see in a bit, develops a tool, then that could feasibly be used by someone in South Africa that's publishing the same data standard. For more information and inspiration, I've linked to our website there. And for us, we try to track impact from this work all over the world. And that means significant, widespread, documented change in either competition, savings, better service delivery, or improved public trust. We also have an emphasis on documenting progress in data use along the way to impact that sort of shows the stepping stones and the process that you might follow to get there. So we've got, again, stories from all over the world that you can look at and be inspired. And it's actually the lessons from our partners around the world that have been especially important in the current context. We've all seen the headlines, and as we heard in the opening remarks, COVID's put the world in crisis mode. And we've seen governments at all levels that are mobilized to purchase urgently needed medical equipment and supplies to fight the virus. As Ms. Duiker mentioned, unfortunately, it's sort of a Wild West scenario where governments are directly competing against each other at times for limited supplies. And as referenced in the opening remarks, there are also bad actors that are often taking advantage of the chaos, such as the SATSIs that have been mentioned a couple times in the chat as well. So we know there are no shortage of stories around corrupt deals for PPEs, ventilators, and other COVID-related spending from my country to yours, and many, many more. And I think it's interesting, Charles pointed this out in the chat, it's not always just corruption or SATSIs that are the problem. Sometimes it's just mismanagement or inefficiency or mistakes that prevent citizens from getting the goods and services that they need. And this is affecting everyone, whether you sit in government, whether you're a company that wants to do business with the government, whether you're civil society that's meant to be getting services in your municipality. So this is sort of a snapshot of the different challenges that we've seen from our partners that are being faced by different stakeholders all at the same time. It's very complicated. But one key thing that we've seen is that open contracting can help. And luckily, the rapid pandemic response of our country partners around the world has demonstrated OCP's vision of joined up open procurement information, as well as cross-agency and stakeholder collaboration. And so some of our partners can show that because of open contracting, they were better able to plan, buy, and deliver essential COVID-19 contracts. Based on this experience, we've drawn up a set of key recommendations, and that's a snapshot of them here. I'll give examples quickly of each in a second, and there's also more information available on our website. But in a nutshell, the recommendations around policy, coordination, data, partnerships, and monitoring. So first, on the policy front, we recommend that emergency procedures should be made public and open. And this was something that came up in Dr. Kumar's remarks that I think is really important. People should know when and how to use emergency procedures, whether there are key safeguards included, whether there are price gouging provisions or other specifications. And similar to the example that Ms Duiker shared, this is an example from the UK, where a recent public policy note provides guidance on procurement regulations in responding to the COVID outbreak. And in this particular case, emergency procedures are allowed to be used, but only if they can pass what's called a public interest test. And so if you see on the right side of the screen, those 4 bullet points are the sort of criteria that need to be met for the emergency procedures to be used. So there needs to be an actual reason for the urgency. The events need to be unforeseeable. It's impossible to comply with the usual timescales. And the last one is interesting to me. It can't be the agency itself that created the urgency. So that's just an interesting snapshot of one way to go about disclosing policy. The second recommendation is around coordination. You should set clear goals and priorities, which is something that we've seen across our work, not only in COVID times, but having shared goals is really important. And this could include consolidated emergency committees for quick decisions. One thing that we've definitely seen is that more agile and coordinated procurement planning and involving relevant stakeholders is key to an effective response and hopefully the eventual recovery as well. So some of the things that actually come up, centralized and coordinated procurement, I think has been referenced a couple times. Framework agreements is similar to the transversal contracts that were mentioned a couple times, that allow for aggregating demand and then establishing oversight mechanisms. So an example of this comes from Colombia, where they quickly recognized the need for fast and frictionless procurement. And as Ms Duiker mentioned, getting the right thing for the right price. So they passed an emergency decree that allowed for expedited procurement procedures. And in this, all supplier companies could be registered to be included in a centralized framework agreement similar to a transversal contract. And all of those suppliers that registered were then verified. And that allowed agencies from all over the country at all different levels to procure efficiently and to compare prices online through this dashboard for emergency procurement that the Procurement Authority has set up. There's also, interestingly, a civil society monitoring component of this that has come up a couple times in the chat and in a couple of the discussion itself. Third recommendation is around disclosure and data. And using open procurement data to share and analyze information to predict and manage critical supply chains. And this came up a bit in the follow-up question to Ms Duiker, but how do we know, how can we predict what will be needed as the pandemic evolves? We don't know, as someone mentioned earlier, how long we'll need to be procuring things and how many times and how often. So the more you can do to open up the information and analyze that can help you predict it better. These are some of the things that we recommend be done. Collecting and publishing high quality open data has been mentioned. Tagging all COVID-19 contracting processes, so those that are monitoring their information can find them quickly. And another interesting thing is for those that are still working toward fully digital procurement, it's still useful to disclose the information that is available, and that can help build trust in the overall process. So we have guidance for this both in the COVID context and more generally. And this is a recent guide that we put out to help collect, publish, and visualize COVID-19 procurement data. And this is interesting because it also includes sort of offline or lower tech resources. So even if open data isn't readily available, there are still steps that you can take to get the information that you need. This is an example from Lithuania, where the government is publishing all COVID contracts in open data and doing special analyses, of that data itself. I'm not going to go into too much detail on that. And in Chile, another example where they have very strong open contracting data standard data that they publish on a regular basis. And civil society then is using that data and red flags risk indicators to do monitoring of COVID-19 procurement contracts. And interestingly, this has led actually to a research project that we're currently doing with the Medicine Agency that's working to improve their procurement processes that will include COVID-19 supplies. Fourth recommendation is around innovative partnerships with business and civil society, and especially supplier insights. And this sort of echoes Albert's remarks about the need for partnership among different stakeholders. So some of the things that we recommend there are working with buyers, so in the government, and suppliers, making sure that they're joined up and able to sort of speak to one another to get the right things to the right places for the right prices. This also allows for red flags and business intelligence tools that are often driven by open data and other analyses. The bottom bullet point there is really interesting in the South African context. I know that there's a lot of talk about beneficial ownership, and that's where this can come in as well, as sort of the due diligence on companies that are trying to do business with the government. So an example from Ukraine, and I'm going to skip through some of these, but I'm happy to share my slides, and there are links to all of these with more information. This is their business intelligence platform that's powered by open data and has been really useful for investigating the links between buyers and suppliers and transaction volumes. From Honduras, an example of price comparisons among government entities and suppliers. And this is actually looking at mass prices at local level and comparing that internationally. And a really interesting example from Moldova, and this is a great example of potential partnerships because it was developed by a civil society organization working with business and government to get all of the information that it needed. And so this is the tender.health platform that was launched, I believe last week or maybe 2 weeks ago. It was developed in just 2 months, and it is a public platform that displays COVID procurement information with user-friendly dashboards and actually has real-time insight drawing on the data that's published by the government. It allows for price comparisons, lets you see how much is spent per health facility, when items have been delivered, which is something that's been really important in the conversation so far, and which companies are supplying that. So there's, again, a link to that that details the experience in developing and launching that. The fifth recommendation, also already very important in the conversation, is civic monitoring. And so the trusting and supporting civil society to play an important role to monitor the efficiency of spending and the delivery of goods and services can be really powerful. Both as a deterrent to potential corruption, and then also for ensuring, of course, that the service delivery actually happens. So here's an example of the Ukrainian procurement system, which publishes excellent open contracting data on a regular basis. There's also a really vibrant civil monitoring platform called Dozoro that works closely with the government to do analyses that are of interest to the broader public. So the system in Ukraine has allowed them to pivot and respond quickly to the crisis, and they're publishing real-time contracting information about COVID-19. And so this is, of course, an analysis of different types of gloves over time as the pandemic has sort of evolved. And last, I'll speak to a quick example from Nigeria, which is a bit different because they're still working toward open data. The procurement agency has begun publishing some contracting information, and we've been working with them to improve that publication and support. We've also worked with civil society partners to advocate for better disclosure and use of that data, especially through analysis and feedback. It's been admittedly a fairly slow process, but we started to see some positive change earlier this year, and then COVID hit. Encouragingly, we've seen, and the snapshot on the screenshot on the right side of the screen shows that the government has started publishing some COVID-19 procurement information on their procurement portal. It's currently in PDF and is a very limited subset of ministries, but it's a start. And interestingly, civil society and journalists have already begun analyzing that data and feeding back directly to the government to improve the information that they're publishing. So it's a really nice example of government and civil society working collaboratively to help improve the information that's available on the government response to the pandemic. And I'll end with, this is sort of tongue-in-cheek, we don't actually want you to loot public procurement. But we put together an idiot's guide to looting public procurement that's especially useful for civil society and journalists that can help know sort of what to look out for. And this is useful in COVID times or otherwise, whether it's single bidding, whether it's ensuring service delivery, looking at owners of companies, et cetera. So the link is there, and again, happy to share the slides and answer any questions. So it's a very quick tour du monde with lots of examples, and I'll stop there, but happy to answer any questions and provide more detail. And I'm especially keen to hear what's most useful for you all in South Africa as you move forward with your response to the pandemic and looking toward the eventual recovery. So thanks again for having me.
Thank you so much, Carey. I'm not so sure about the slide about the idiot's guide to looting. Let's keep it away from the tsotsies that we were talking about earlier. They may just read something into it that we don't want.
Right, exactly.
No, thank you very much. That was really interesting to look at a comparative overview, and I really appreciated the fact that you gave us really relevant examples. Because often we're forced to compare ourselves with Sweden and Switzerland, and then we always feel that we are way behind. But these are some really relevant examples from countries in similar circumstances that we are. So very interesting and relevant presentation. Thank you so much. Let's use the last half an hour for some debate and Q&A. And maybe the best way to do this is to just take a few questions or comments and then ask our panel to respond. So if you want to raise a question or make a short input, make yourself known either by raising your hand on the participants list or just start talking, and then I'll hand the floor to you. And of course, we also keep the conversation in the chat going. So anyone who wants to kick off the discussion. What I've been finding very interesting is flowing from the last presentation. And I may be wrong, I'm not the expert here by any stretch of the imagination, but I think South Africa has come very far in terms of transparency in budgeting. We always score very highly with transparency indices when it comes to budgeting. And we also, I think we are developing platforms now. I'm thinking of Vula Kamali, which is a platform in partnership with the National Treasury that makes budget data available. I'm not so sure whether we are as good as some of the examples that you showed us in showing the information that is relevant after the budgeting and even after the awarding of the contract. So that for me is an interesting takeaway. And maybe I'm wrong, maybe there are platforms and mechanisms available here with which we can follow, the kind of detail that you pointed out, and I'm just not aware of it. But it seems that is, going back to the very first comment that Shumani made about how do we figure out, how do we know how many times the tanker is supposed to come and what has actually been purchased by the municipality in terms of service that we can then monitor in our community. For me, that remains a very interesting theme. Anyone who wants to come in? I'm not seeing any hands. That could be my own lack of. There we go. Albert, do you want to make an input?
Yeah. So I've heard over the last couple of years, I've heard a few times that that one of the reasons why something like the tender portal is quite poorly populated. So people go there, you'll see that most of the links are dead, and most of the information that one needs to monitor isn't there. So very often, the reason that is cited for that is that the submission of this information is voluntary. So while the space is managed by national government, the submission of this information and its appearance in something like the tender portal rests on the relevant local government or national provincial department. But that arrangement is, if we look at the state of procurement transparency, as you've indicated, that mechanism clearly isn't working. So I'd be interested to hear from any of the panelists really. What some of the how we fix this. So I don't know if Carey has international examples of centralized platforms that are populated by local governments and line departments. If they have mechanisms to ensure this. Or either Krish or Basani have some ideas about where we're getting stuck at the moment. I'd be really interested to hear more about that.
Just to underline that that point that Albert made is because I'm getting the sense that we placed a lot of emphasis, as I pointed out earlier, on the institutional oversight. The various lines of defense that the Auditor General checks up on, and that we expect the system of procurement to heal itself. That's essentially what we are expecting. And I think here the point is being made that we need to bring communities in as partners, but for that we need information to be published regularly and in an accessible format, so that communities can assist in achieving accountability. Because I think if you look at the series of Auditor General reports that we've seen, the system is not very busy healing itself at the moment. That's one thing that we can say for sure. So how do we get that partnership going, and what would be some of the solutions that we can look at? Any contributions from the floor or from the panelists?
It's Carey Kluttz from OCP, certainly not the expert in the room on South Africa specifically, but I think the issue that both of you raise actually is something that countries around the world are struggling with. And one thing that we've found through our work, and actually sort of underpins our new strategy that we launched about a year ago, is the need to really get buy-in from all of the different actors, and that includes from different parts of the government, understanding why publishing this information actually makes their job easier. So that's something that we've really been focused on working with partners, an increased focus on change management as well. And the Nigeria example actually that I cited is perhaps a particularly relevant one, as they really struggled to get different ministries, departments, and agencies, what they call MDAs, populating the portal. And it's not just Nigeria. But in Nigeria, there's an especially strong civil society sort of ecosystem that's really been analyzing that information and then feeding back to government on which MDAs are and are not complying. So as Albert mentioned, the links that are broken, right? Who is not actually submitting information to the tender portal? And they've started doing a ranking. It started with which ministries were responding to freedom of information requests, and it's now evolved to which ones are complying with the regulations for, inputting, in this case, inputting information in the tender portal. So that's something that might be interesting to sort of just do a ranking that says, this is public information. These entities are doing a great job. We, celebrate them, but there's a lot of work to do with these others. And I think the last thing that I would say is in South Africa, you're at an especially sort of maybe opportune moment now with the draft procurement bill going for revisions. And we, at OCP, we submitted comments on that bill. I know that there are lots of partners on this call that have as well. So I think that's an interesting opportunity that could help address some of these issues. So I'm happy I can add to the slides that I shared, the comments that we sent in case that's of interest. Thanks.
Great, thanks, Carey. Ms Duiker?
Yes, thank you, Chair. I will ride on Carey's wave. I think she started off very, very well, because for us, the public procurement bill is a very opportune time for us. And it is a game changer. It will be a game changer for us as the custodian of the prescripts to consolidate the policies and the prescripts that are related to supply chain and public procurement. And I think it is through that bill that will allow us to revise the standing of the different prescripts that are currently applicable to make sure that they are addressed properly. And the procurement bill will allow us to regulate even local government as well. So that's the one aspect that I think will help to resolve issues such as the sort of non-mandatory reporting requirements and other transparency issues. Look, transparency is a principle that is required by our constitution. I don't think it's something that it needs to even be debated or discussed upon. I think for us, it is a matter of finding mechanisms to make sure that transparency is done in a manner that is more useful and user-friendly and accessible to any person walking down the street. Currently, there are ways to make sure that this information is published. I think maybe the question or the challenge may be it is not provided in a manner that is easy to access and is useful for all the stakeholders. Because I saw one of the comments in the room that said, for example, that performance agreements and service level agreements with service providers are actually required to be published. But whether the municipalities are actually doing it and doing it consistently and in the right manner leaves to be checked and monitored. So I think I'll leave it at that for now, Chair. Thanks.
Thank you very much, Ms. Duiker. Professor Reddy, welcome, and please make your input.
Thanks very much, Chair. In fact, we have been involved in a research project where we looked at the management of COVID-19, and basically we solicited reports from about 52 countries. And basically, none of them actually mentioned the whole issue of corruption with regard to procurement and so on. But on the other hand, we never asked them to respond to that question. This might be in the second round. Now, what I want to know is, if you're looking at the South African context, how serious has the problem been if you're looking at emergency procurement, especially during the COVID period, if we have to compare ourselves internationally? Thanks very much.
Thank you so much. We'll put that to the panel in a moment. Are there any other questions or comments on the issue of emergency procurement? Shumani, are you convinced? Can I put you on the spot a little bit? We started off with your input and your very clear articulation of the importance of transparency. Are you convinced?
My heart sank a bit when I got to understand what this section 36 is all about. And I think, they've got a free rein. And what we see on the ground, it's very disheartening. And all because Treasury says you can choose to respond to this circular. You can choose to do this and that, and it's allowed by law. Being convinced is something else, but I think it's about time. I like also the statement you made to say this whole process, cannot heal itself. There has to be something. And I agree with Ms. Duiker, who says maybe there has something to be done. I know our constitution gives out a lot, but oftentimes all these legislations are left for interpretation by those in authorities. And oftentimes they will interpret it and put measures that helps them and not us as the community. I'm still talking as a community member, because when you talk of what government is doing, all of it comes down to me in the community, because they're doing it in my name. We are spending so much money to buy sanitizers and all that. And I'm here in the community. Where is that sanitizer? We are spending so much money. It's well and good. Section 36 allows them to do it quickly and not go open about people to tender and all that, because it's an emergency. But who is making sure that those PPEs and those sanitizers get to the relevant hands in the communities? There are places where they are doing very good work, checks and balances, they are monitoring. But we are saying there are still places where monitoring is not happening. And we hear that municipalities are procuring these things. And on the ground, we don't see them. We hear that tanks are coming and there's somebody who was supposed to have put a slab so that the tank will come and sit properly. When the other tanker comes to put water, that thing is secured. But we don't see that happening on the ground. And I think that's basically what we're saying. Emergency or not, the principle remains. Let's do what is proper. And let's give value for money to the communities. Yeah, I think I will leave it at that.
Thank you very much. I also see a hand, Mr. or Ms. Sakumzi Maikiso, over to you.
Yes, thanks, Chair, and good afternoon to everyone. I must say first, reading the timelines, the chat, it's quite interesting. And I think, what the lady just indicated now, it sums everything up, no matter what we can say and how we can say it, the bottom line is, something has to be given to someone. Whatever we procure, it has to land in a space where people can use it. Now, back to Ms. Basani Duiker's comment, about the bill, the procurement bill that has been, that is now in the making, that would now regulate all spheres of government equally, and also how the procurement is done. And I think, equally to that, we've got the Constitution, which indicates that people need to be informed. I need to be informed because I'm a member of the community as well. But the appetite and also the quality of information that, that is being put on either the e-tender or the municipal website or the notice board, wherever the case that is for accessibility, I think still lacks the quality that one can make an informed decision about whether the service which we ought to receive is delivered to the level that we're supposed to get it. That's number one. So if you go to any of the website, the information, the quality of the data or the quality of the information is not to the point where it allows anyone to make an informed decision. Now, which leads me now to another point that I just wanted to make, is that whilst the procurement bill is in the making, or it's going through all the processes that needs to be done, we also need to think about the enabling systems that needs to go with it, that needs to be able to produce the data that we can put into information. So as it stands now currently in the country, right across municipalities, provincial departments and also national departments, the systems don't even speak with one another. The data that is in the systems, it is in a point where, you know, it cannot even produce reliable information. You know, that is the gravity of some of the issues that we need to deal with. Yes, whilst we want to have all of this information, but what kind of systems, or what can the systems do? You know, so I think for me, my approach also, we need to think a little bit further, you know, down that line. And I agree with everyone in the, you know, that we've been chatting in the comment section, that information, we need it. Yes, we need it. It needs to be posted. It needs to be there, and it needs to be in the language that is also understandable to the very same community that's supposed to read and understand that information. Not to a point where it's too technical, that people, you get the information, but it becomes, you know, it just becomes completely, you know, Greek in your understanding. So that, for me, I think some of the issues that we need to look at, you know, moving forward down the line, because we need the information. We also need to make informed decisions, and data becomes critically important in all of this, you know. So that's just the commentary that I just had in mind. Thanks.
No, thank you very much, Mr. Maikiso. That's much appreciated and very much on point. I see Ms. Duiker wants to respond.
It's not necessarily a response, Chair, but it's just to add to what Mr. Maikiso has just said. And just to also put it there that, you know, I agree fully. And like I said in the earlier comment, that I think if anything, maybe what we really need to look into is finding a way to present the data or the information that needs to be published in a way that is easily accessible and user-friendly and easy to interpret for anyone, really, even if it's a school child for that matter. But similarly to that, I think we also need to find a way to also hold our suppliers and service providers accountable, because I think they also need to come to the party insofar as these matters are concerned. Yes, we have a responsibility as a government, and the municipalities and accounting officers have a responsibility to ensure, as part of their financial management, that the state resources are used for what they're supposed to be used for and account for it. But I think that similarly, the suppliers as a stakeholder to this process, or as a party to this process, also we need to find a way to hold them to account to what they do and how they do business with government.
Jaap, you need to unmute.
Dr. Kumar, we can see your hand, but we can't hear you yet. I'll get you the floor. I was muted, sorry. Over to you.
Okay, thank you. I think, let me make an admission. I think when it comes to civil society partnerships, I think we're weak. I think we may have data, but I don't think we take communities on board, either in planning for work that goes out to a particular community, or for that matter, when we've awarded a contract, etc. That can be done, but we're not strong on that. As I was indicating, we rely more on the political structures to do that on our behalf. So even with the IDP, we go out, we accumulate information that's required. When it comes to service delivery, we will go annually on the budget and we provide feedback in an annual report, but the actual projects per se, we don't take that to community level. And I think we must admit that is a weakness on our side. I think it will certainly help strengthen accountability if we actually make communities aware of projects going to the area, the value of that project, and ensuring that service delivery that is expected and communities can monitor the oversight. What I'm worried about is the maturity of communities to be able to manage that, and we need to ensure that effective mechanisms are put in place to deal with that. I think Professor Reddy, just on the other issue, the issue of the portals and whether they're effective or not. I think I must commend again National Treasury with the Central Supplier Database. I think there you actually have a situation where only if companies are registered on a central supplier database are we able to procure with them, and your e-procurement systems must be linked, etc. So that ensures more effective systems. However, the actual portals, if being effective, we need to actually see what kind of oversight can be put in place to deal with those issues. But I think a good start has been made with the centralized supplier database. Professor Reddy raised a very pertinent point. How serious is the problem in South Africa in terms of procuring under emergency conditions, and particularly during COVID? I think, Professor Reddy, it's difficult to answer that question. Each municipality needs to account for their own. And in that regard, I think the oversight with regard to Section 36 becomes critical. I think we know that there's a special emphasis put by the Auditor General, by our own internal audit structures and our own oversight structures politically in the council to ensure that value for money has been received, and provided people have actually shown benchmark costs, etc., that becomes critical. But what worries me, and I must be very honest about this, is the point that's being raised, where communities have an expectation, or they don't have an expectation, but they don't know. But the intent was to procure either water or water tankers, and they don't get delivered. That's something I cannot put my finger on the pulse on to give an exact account for. I think the other issues in terms of value for money on paper, in terms of what we paid for, but what was delivered becomes a very moot point. And it's something that, again, requires greater transparency, accountability, and how we manage those issues, I think, is through effective consequence management, where if we find people wanting, we do the right thing, and that's a breakdown of trust, and we should show people the door. So I think that for me is something that needs to be tightened up. And as I indicated earlier, the Public Audit Amendment Act, together with the issue of material issues that will come through with the audits, would help, but that's right at the end. Local government itself, in terms of the structures that it has, should hold people to account. And I think if we start to build in community partnerships right at the very early stages, it will help. We just got to build maturity into that process and see what structures we go through and make sure that doesn't cause delays in service delivery from a planning perspective. So I think that would help us to deal with those issues in a far more effective way. Thank you.
Thank you so much, Dr. Kumar. We are starting to reach the end of our time together, so we can take one or two more questions. I have Dr. Fuo. Can you make your input, Oliver?
Good afternoon, colleagues. Thanks very much, Chair, for giving me the opportunity. I just want to indicate to colleagues that I've been looking at procurement law and policy for some time now, and it has come to my realization that the nitty-gritties in terms of the regulatory framework will differ from country to country, but there is generally consensus on overarching principles that is supposed to guide public procurement. And in terms of our law, we are doing well in relation to that. Our law adequately caters for, generally speaking, those overarching principles. The problem or the main challenge probably relates to implementation and the commitment from politicians to ensure that there is compliance with that. And I also looked at our draft procurement bill. I've been able to read it from start to finish. I don't see a lot of fundamental changes that are brought about by the bill. It is simply an attempt to really deal with fragmentation that we have. We don't really have a lot of fundamental changes that are brought, that will be brought as a result of the draft procurement bill. And one of the issues that a lot of colleagues have really agreed on in the comments that we've been sharing relates to the relationship between politicians and the administration. And in terms of our law, we see that they have also made a genuine attempt to separate that relationship, ensuring that politicians don't have a lot of say in terms of procurement decisions, but we know that is also not what obtains on the ground. And then an issue which we have not really emphasized is the lack of capacity in a lot of municipalities. I realize in a little survey that we conducted as part of some work that we are doing, that about 20% of senior officials in procurement, supply chain management, municipalities do not even have a degree. And those are the ones who complain a lot about not even understanding a complex system that is highly regulated with different legislation that has to be applied. So those are a few comments that I think I can share with you. Thanks.
Many thanks, Dr. Fuwa. Many thanks for that input, very useful input, and clearly the debate continues also on the relevance and the impact of the procurement bill. I think we have reached the end of our time together. This is what we have made time for. So I think I want to thank all of you. This has been a very insightful seminar. And it's great to see that so many of you stayed until the end. You know, it's very easy to sign up for a webinar and after 10 minutes clock out. But the vast majority of you stayed connected, and clearly we provided value in the quality of the presentations and the discussions that we gave. So thank you very much. We will make sure that all the recordings will be made available to you, as well as the slides. We'll collect the slides from all the presenters. I'm assuming that they will all be okay with those being circulated. We'll make sure that we do that. I really wanted to thank the support team, Valma Hendricks, Mandy Cupido, Dr. Tanash Chigwata, and Tracy Uester from IBP for all the assistance and all the work that went into putting this seminar together. And then, of course, the authors and the speakers, Carlene, Albert, and our esteemed panel for today. Thank you so much for making time available. I know many of you are extremely busy people, so we really appreciate you, addressing us and giving us your insights. It's been much appreciated. And thanks to the audience for being so disciplined on this sometimes complicated Zoom scenario. I think we're getting used to it, but it remains always a bit of a challenge. So thank you so much. Look out for the next webinar. We will host another one in the foreseeable future, again looking at the impact of COVID-19 on issues of transparency, financial management, budgeting, etc., etc. So look out for the next webinar. And with that, I want to thank all of you again and urge you to stay safe and look after yourself and those around you, and have a nice day. Thank you so very much.